Hey y'all, today we're going to talk about the psoas, which is known as the fight or flight muscle. It pulls you into the fetal position, and it's also one of the main muscles that you run from because it connects the trunk to the legs. So just a photo. So basically this is right behind the diaphragm, so that's just at the base of your rib cage. It then comes superiorly, so kind of in front of the body, right around. For women, I call it where the ovaries are. For men, I say where your belt loops are. So basically it's just down into the side of your belly button. And then it inserts into your inner femur. So basically what can often happen is that one side becomes a little bit more contracted than the other side, and then it pulls your pelvis and then kind of your spine into a bit of torsion. So if you have habitual back pain or habitual lower back pain, it's a lot of people would talk about that you need to release your psoas. There are also kind of a few different ways of getting at releasing the psoas. So you could go for a more passive version, which is what Liz Cook, who wrote the Psoas book, advocates. I personally think that doing an active release is totally fine. I don't think that the psoas muscle is the fight or flight muscle in the body. That's a little bit more emotionally connected more than any other spot in the body responds to stress or emotion or PTSD or trauma backgrounds. So what she advocates is what's called the constructive rest position. So you would just lay on your back, legs bent at about 45 degrees, and that you would, potentially also have some pillows under your legs to provide some relaxation to your pelvis, and that you would lay there up to 20 minutes because that sort of puts the psoas muscle in a neutral place, and that it would gradually just relax on its own. What I'm going to show you today are some other active release options that you have that would be done with tennis balls, lacrosse balls, and then also getting more specific about where you would want to release depending upon which side is torsioned for you, and then figuring that out for yourself. So let's get started. Okay, so the second portion is something that you could do with a couple of balls. So in this case, I have some softer balls. They're about 2.5, 2 inches. You could use tennis balls, you could use lacrosse balls. And where I'm looking to put that is about right there on either side while I'm on my stomach. That's a general indicator. You're basically looking for whatever the tender spot is. So I'm going to give you some options after you do that. So I have the balls in those spots. Right now I'm on my elbows, which is going to put a lot more pressure on those balls. If that's too intense, I could just lay flat. Some leg options from here would be lifting and lowering, as that once again kind of puts more of a pressure on that fulcrum point. If you have active lower back pain, that might be a little bit too intense. I can also bend my knee and kind of do the same thing and push up. I can also bend my leg and sort of wave side to side, so I'm doing internal and external rotation. And then I can also do that both sides at the same time, or I can do oppositional windshield wipers. So that's using balls to create a psoas release. You can also just completely hang out and breathe into those spaces. Option number 2, and this is where it kind of gets more into the active of what's best for you. So if you're somebody who has more mid-back tension or that the torsion is in the mid-back, and the way that you would know if you are is that more ideally you could reach around and kind of feel. So what you're trying to feel for is which of the facet joints, so kind of the nubby parts on either side of the spine, feels like it's more forward or more backwards. You're going to want to release the side that's more forwards. You also could feel for the divots on your lower back, kind of back in here at the SI joint, and feel if one of those is more forward or not. Okay, so if the mid-back is more of the issue, you would kind of feel around, so this is the bottom of my rib cage, and then I'll know where my psoas is if I lift both legs. And so I can feel it kind of jut out right there. So I'm going to go just to the outside of it, and just do my left side because that's the side that I know tends to go more forward. So I've got my fingernails kind of pressed up against the side of the psoas. What I can do from there is do some anterior or posterior pelvic tilts. So this is kind of like cat-cow from yoga. I could also add in a leg slide back and forth as I do that. Sorry, I should do the side that I'm doing. I could also, right now I'm on a table that's elevated, I could lift up, turn my leg in and kind of drop it off to the side. And with each of these movements, I'm gradually digging in a little bit deeper. Then, once I felt like that tender spot or just the sensitivity in that area dissipated, I would then do just a little bit with both sides. So once again, I'm just to the outside. So there's my pelvic tilts. I could slide both legs back and forth. The sliding of the legs or lifting both legs, if you have active back pain, might be a little intense, so you could always just barely lift a heel. If I know that my problem is in the lower portion, I would actually want to go lower, so this is more in my lumbar spine, and I would actually want to dig inside of that. So once again, I could lift. Here's where it juts up. I would be reaching inside. And then I'm kind of fishing around in there for a tender spot, and then it's the same thing, pelvic tilts, leg slides, option to drop off to the side, or you could even just have the legs straight or bent and just turn in and get at it that way. Same thing after that, I would do both sides at the same time. Thanks for watching.